Okay, in the previous MC video, in my previous video, you have seen that I have told you that xiphoid process, whatever level has been asked, that is the xiphoid process lies at T9 to T10 level, whereas the xiphi-sternal joint lies at T9. Question number 39: which type of muscle fiber predominates in the diaphragm, enabling continuous rhythmic contraction for respiration? The answer is slow twitch oxidative type 1. Type 1 fibers are fatigue resistant and rich in mitochondria, ideal for sustained contraction and respiration. Pain from irritation of peripheral diaphragm. Costal pleura is felt in which area? Lower chest wall. Peripheral diaphragm innervated by the intercostal nerve, that is T7 to T11. Pain referred to local thoracic abdominal wall. Central diaphragm is equal to phrenic nerve. Shoulder referred shoulder pain. Question number 41: a 2-year-old uh, a 2-year-old child has eventration of diaphragm where one dome is elevated but intact. What is the cause? Failure of muscularization of the diaphragm. Eventration, thin membranous area due to the absence of the muscle fibers. Diaphragm balloons upward during expiration. Chronic upper respiratory infection, ciliary damage. A 25-year-old male with chronic upper respiratory tract infection undergoes a nasal biopsy. Histopathology reveals damage to structures responsible for mucociliary clearance, and which structures are responsible? Cilia. Cilia and respiratory epithelium moves mucus and tract particles upward. Chronic infections or smoking can damage cilia, impairing mucociliary clearance, leading to infection recurrence. Question number 43. Alveolar histology, flattened cells. A 32-year-old MPhil researcher is examining lung tissue under a microscope and observes spindle-shaped flat cells lining the alveoli. These cells are most likely type 1 pneumocytes. Type 1 pneumocytes are flat squamous cells forming the air-blood barrier for gaseous exchange, while type 2 pneumocytes are cuboidal and separate surfactant. Question number 44. A biopsy from the posterior part of the nasal cavity is examined under a microscope. Which type of epithelium is most likely present? Pseudostratified columnar ciliated. The respiratory epithelium of the nasal cavity, pseudostratified columnar ciliated epithelium with goblet cells, important for mucus secretion and particle trapping. Sometimes goblet cell function is also usually asked in the viva. Question number 45. Congenital brachioesophageal fistula, newborn presents with the choking during feeding and respiratory distress. Imaging shows an abnormal communication between trachea and esophagus, which embryological structure normally separates the two tracheoesophageal folds. The tracheoesophageal folds fuse to form folds used to form the tracheoesophageal septum, separating the foregut into trachea and esophagus. Incomplete fusion leads to tracheophageal fistula. Sometimes this question can be asked to you in the short answer question. So you are going to reply it like this. Respiratory system origin. During development, the respiratory system arises as a ventral outgrowth. From which structure? It arises from the foregut. The laryngotracheal diverticulum bud forms from the ventricular wall of the foregut, giving rise to the trachea, bronchi, and lungs. Question number 47. A 2-year-old child has congenital laryngeal stridor due to defective development of the pharyngeal arches forming the laryngeal cartilages. These cartilages primarily develop from which arches? They develop from the fourth and sixth. The fourth and sixth pharyngeal arches form the cartilages of the larynx, which are innervated by the branches of the vagus nerve, superior and laryngeal recurrent laryngeal nerve. A patient with pulmonary tuberculosis shows enlarged lymph nodes at the root of the right lung on the chest X-ray. Which group of lymph nodes is most likely affected? Bronchopulmonary. Bronchopulmonary hilar lymph nodes are located at the root of the lung and drain both the bronchi and pulmonary tissue, commonly enlarged in tuberculosis. Question number 49. Fish bone and piriform fossa. पेरिफॉर्म फोसा जो आपका बनता है ना, वो आपका बनता है लैरिंग्स में. पेरिफॉर्म फोसा की समटाइम्स बाउंड्री भी पूछी जाती हैं, ठीक है, कि उसके मीडियली क्या है, लैटरली उसके क्या है. मीडियली जो होता है वो एरी एपिग्लॉटिक फोल्ड होता है, लैटरली जो है वो थायरोहाइड मेम्ब्रेन होती है, ठीक है. A 65-year-old man swallows a fish bone that lodges in the piriform fossa. Surgical removal risk injuring which nerve? Internal laryngeal nerve. The internal laryngeal nerve supplies mucosa above the vocal cord and traverses the piriform fossa, making it vulnerable to injury. Now you need to learn that whenever you are going to perform there, whenever there is injury in the piriform fossa, internal laryngeal nerve is at risk. A 65-year-old man with COPD, chronic obstructive pulmonary disease, shows prominent use of neck muscles while breathing. Which muscle is acting as an accessory inspiratory muscle? Sternocleidomastoid. Sternocleidomastoid elevates the sternum during inspiration, assisting in forced breathing in respiratory distress. For example, COPD. This question is usually asked. Scalenes in the inspiration. A 60-year-old COPD patient shows elevation of the first and second rib during inspiration. Which accessory muscle causes this action? Scalene's muscle action perform this action. Scalene muscles elevate the first and second rib during inspiration, aiding thoracic expansion in labored breathing. After abdominal surgery, a patient shows right hemidiaphragm elevation on the chest imaging. Which nerve is most likely injured? Right phrenic nerve is injured. The phrenic nerve C3 to C5 supplies the diaphragm. Right nerve injury causes paralysis and elevation of the right dome. Commonly asked questions. Question number 53. A 40-year-old man sustains blunt trauma to the lower chest and develops herniation of the abdominal contents into the thoracic cavity. Which part of the diaphragm is most commonly ruptured? Left crust. The left crust is more prone to rupture because the liver protects the right side. High intra-abdominal pressure may cause the left diaphragmatic tear that leads to herniation. A 5-year-old boy aspirates a peanut that lodges in the right bronchus. Which the lung part is most likely to get involved in this case? Right lower lobe. uh, right lower lobe. The right, I think the answer should be right upper lobe, but still the right upper lobe must be the should be the answer. But further reconfirmation is necessary. Right main bronchus is wider, shorter, and more vertical. Foreign body tend to enter the right lower lobe due to gravity. uh, Now this needs to be evaluated whether either this is the upper lobe or this is the low. This should be the lower lobe. Epistaxis Kesselbach area. A 28-year-old man presents with anterior nasal bead epistaxis bleeding it from Kesselbach area. Which artery is most likely responsible? Anterior ethmoidal artery is responsible. Kesselbach area. Kesselbach plexus in the anterior nasal septum receive blood from the multiple area arteries, but anterior ethmoidal artery commonly causes anterior epistaxis. The question number 56. An adult aspirates a small object that lodges in the posterior segment of the right upper lobe. Which position best aid drainage of the segment? Prone with head down. Postural drainage for posterior right upper lobe leads to patient prone head down, so gravity assist mucus or object clearance. Nasolacrimal duct obstruction. A child places a bead in his nose that lodges in the inferior meatus, drainage of which structure is most likely affected? Nasolacrimal duct, because nasolacrimal duct tears from the lacrimal sac into the inferior meatus. A foreign body here may block tear drainage. Epiphora. For question number 58. A lung biopsy shows thin flattened epithelial cells closely associated with capillaries. Which type of epithelium line this area? Region. Simple squamous epithelium. Alveoli lined by simple squamous epithelium. Type 1 pneumocytes to facilitate efficient gaseous exchange between the air and the blood. Question number 59. A premature infant develops respiratory distress shortly after birth. Microscopically, alveoli appear collapsed with eosinophilic membranes lining their walls. Which of the following best explain this finding? Deficiency of the surfactant. Premature infants often have immature type 2 pneumocytes, leading to reduced surfactant production. This causes alveolar collapse and hydrogen membrane disease. NRDS. Non-respiratory distress syndrome. Question number 60. The developmental biologist observed failure of branching morphogenesis in a fetal lung specimen. Which signaling interaction is primarily involved in bronchial branching? FGF10 SHH signaling. Lung branching is regulated by FGF10 from mesoderm stimulating bud outgrowth and SHH from endoderm controlling patterning, critical for airway branching.